Shall we start?
Yes, ma'am.
Yes, ma'am.
So when mouth breathing is prolonged for a long duration of time, there will be certain disadvantages. But what are the advantages of breathing through your nose? Anyway, most of the individuals breathe through nose throughout their lifetime. And the advantages for nose breathing are when the inhalation and expiration is through nose, there will be production of nitric oxide, which increases the ability to transport oxygen throughout your body. So nitrous oxide is also mentioned or suggested as having an activity of antifungal, antiviral, antiparasitic, and antibacterial. So it helps the immune system to fight the infections when their breathing is through nose by production of nitric oxide. And the other advantages of nose breathing are filtration and adding moisture to the tissues, preventing dryness in the lungs, etc. So nose breathing is mostly advised. But when it comes to mouth breathing, how do we know one is breathing through his nose or mouth? When mouth breathing is seen in some individuals, we may see some of the following symptoms like snoring, dry mouth, bad breath, hoarseness in voice, and waking up irritable, and chronic fatigue and dark circles. This is due to insufficient sleep and tiredness. Right? The most common symptom we see in mouth breathers are snoring and dry mouth and halitosis. These are the three common symptoms we notice in mouth breathers. But coming to the children, we cannot take symptoms recorded from children, right? They may not be able to say. So the parents should identify the symptoms or look for the following symptoms to identify any mouth breathing habit in their children. But what are the symptoms that we see in children to categorize it as a mouth breathing? Right? Slower than normal growth rate, irritability, and increased drying episodes at night, large tonsils, dry cracked lips, and problems concentrating at school, and daytime sleepiness. These are the symptoms that will be useful for parents or the physicians to diagnose the mouth breathing habit in children. Coming to the classification of mouth breathing. As given by Finn, it is classified into three types, that is anatomic, obstructive, and habitual. Anatomic, that is due to short upper lip that permits incompatible closure of the mouth, and obstructive, that is complete obstruction of the normal flow of air through the nasal passages, and habitual. It is the continual breathing from mouth by force of habit, although abdominal obstruction has been removed. The most common cause of mouth breathing is obstructive type. It is the most common type we see in either children or adults. So what causes mouth breathing? The etiology. Cause is nothing but the etiology. That is the obstructive or pathological blockade of the nasal passages. And these blocked nose can occur due to the following conditions like nasal congestion, which is caused by allergies, cold or sinus infection, and enlarged adenoids, enlarged tonsils and deviated septum, and nasal polyps, which are considered as benign growth of tissues in the lining of your nose, and enlarged turbinates and the shape of the nose and shape and size of the jaw. And the blockade may also be due to some tumors or cancer.